20-year-old Happiness, a nurse midwife who's been practicing for 2 years. She's the first in her family to achieve post-secondary education. As a millennial youth, she's the one out of every 8 Tanzanians who uses the World Wide Web and a mobile phone. When school ended, Happiness dreamt of making the world a better place for Tanzanian mothers and babies, but reality shock. 1 in every 19 mothers dies of childbirth-related complications. 1 in every 47 newborn dies within the first 28 days of life. Happiness finds herself giving babies an uneasy welcome. Even worse, she works in a clinic with weak infrastructure, poor staffing, inadequate medication, supplies, and equipment. Happiness typically leaves work late and exhausted, mainly because she needs to document in 3 places: the client chart, the facility, and the Ministry of Health stats. These are the types of working conditions that promote disrespectful care and abuse. In fact, she's witnessed shouting, slapping, cursing. She felt powerless to advocate for clients. The stress is always high, and vulnerable mothers like adolescents, HIV positive, or ethnic minorities get the brunt of her coworkers' anger. If only she could give info and assess danger signs with clients and village community workers, then she'd understand what's happening. Instead, clients arrive too late with hemorrhaging, labor for 3 days, or even worse, a dead baby. Happiness dreamt of a 40-year career, but now, not so much. It's a job. She feels more connected to her Facebook friends than she does her healthcare system. If Happiness had access to a culturally appropriate EHR with mHealth tech, what could she do? She'd have the power to more than document or to provide a repository for big data research. She'd have a 2-way window, a portal to respectful care, allowing access to health education, timely health service, and shared decision-making. Access to otherwise hidden physical resources, like whose vehicle is free to rush mom to hospital. Happiness would have URL links to current guidelines, medical consultants, and continuing ed. Now that's empowerment, evening the playing field for every worker, every woman, every adolescent. It's time to change the patterns of health info transfer and LMICs. Low-cost, low-tech equipment is already here. Effective women's health software has already been developed. HIT for LMICs, a technology